So what are the treatment options for a knee that has pain and that is typically due to osteoarthritis or perhaps trauma as a younger adult? So we're going to talk about that now. So what happens when the cartilage wears off the end of the bone? The nerve roots are exposed. It's kind of like having a tooth where the enamel wears off. Suddenly that nerve root is exposed. It's hard to drink the coffee or eat things that have a crunch because it causes pain. Very similar in the knee. Once the cartilage wears off, the nerve root is exposed. It sends signals to the lining of the knee to make the knee swell. So frequently we'll see swelling, we'll see pain, and again that limits motion and makes it hard to do your activities. So the options are a couple. One, of course, is if you're like me, you got to lose a few pounds. I've got some arthritis in my knee or hip. And losing some pounds can make a difference. And I've seen that personally, and it works. The knee is a funny joint. At least 2.7 times your body weight, anywhere up to 8 times your body weight with certain activities, can go through your diseased knee joint. And so a 10-pound weight loss could be 27 to 80 pound weight loss for your knee. So that's really crucial, I think. And I do think a lot of doctors forget to include that and discuss it. We don't want to mention it, but I think everyone in the United States, most of us, can lose a few pounds. So that's number one. The next thing would be different kind of over-the-counter medications. I think many people have tried acetaminophen under the brand name of Tylenol. That can help. There are anti-inflammatories, non-steroidals they're called, such as ibuprofen, naproxen. Those run under brand names like Advil and Aleve. Those things you have to be more careful with. They can irritate the stomach and could cause an ulcer if you take them daily on a weekly, monthly basis. So you need to be somewhat careful. They can irritate the kidneys, make your ankles swell. Those things you need to use in moderation. And in general, if you're having side effects such as heartburn and so forth, you should stop and discuss with your doctor. There's been some interest in the CBD oil. That's a really difficult subject to address, and is perhaps something that you need to do some internet research on. In New York State, it's unregulated, so I can't really advocate for or really go against those products. The next set of options that we typically talk about are intra-articular injections. There's things like steroid injections. There's another type of product that is a gel that also may help reduce the inflammation inside the knee. They are not cures for the knee arthritis, but they can help in certain cases help relieve swelling and pain. So we frequently consider those depending on what your x-ray looks like, how long you've had pain, etc. We do have a couple new treatments such as freezing the nerves around the knee, and there's several different ways that can be done. And then lastly are the surgical interventions. In general, with a knee that has severe osteoarthritis, wear and tear arthritis, most of the time it's more than one compartment, so most of the time a standard total knee replacement is the answer, although sometimes a partial knee replacement is also the answer. So that's generally the entire kind of gamut of options. The only other things we didn't touch upon would be icing the knee after doing an activity, and perhaps some gentle exercise. There are some diets. The Arthritis Cure is a book that talks about how diet can affect your pain in the joint. So those would be other options to also consider.